this incredible social change and the lower age of coming out speak to this tension that I get asked by particularly like undergraduate students and reporters that say, well, if it's so much better, how come it's so much worse? And I think that this speaks to this, what I think of as a paradox, that there is this dramatic social acceptance, young people are coming out at younger ages, and yet there's been unprecedented concern in the public in the last now 3-4 years, awareness for bullying, homophobia in schools, sexual prejudice. And so this paradox has been sort of one of the things I've been thinking about, which is if things are so much better, why all of a sudden, why are we giving all this attention to the risk? And I get that a lot, and it's concerning, because people say, like, Stephen, isn't everything better now? You know, don't we have marriage? Didn't NCFR just say that it's all cool? You know, can't we just shut the book and everybody's fine and let's get on with it? Well, not yet. So let me tell you, as a person who thinks about young people and their development, let me tell you why I think we need to have concern, and then let's try to contextualize that and figure out where to go from here. This is data from a huge survey of over 200,000 young people in schools in California, the biggest health monitoring survey that California does. And if we just look at the proportion of kids in 7th, 9th, and 11th grade, more than a third report some form of bullying. But what I want you to see is that 75% of the kids that report some form of bullying report bias-related bullying. And there's a whole other talk to be given about the crazy-makingness of the bullying research and the degree to which, and when we study bullying, we have just completely, categorically ignored the motivations behind bullying. And at least according to this data, 3/4 of which is motivated in prejudice, discrimination, or some kind of bias. And what are the implications? Does this matter? Do we care? And so drawing from the same study, we looked at a number of different health and achievement sort of outcomes for kids. And I've shown this to some of you will have seen this before. This is a rewind for some of you. But do I have a pointer? That's OK. Look at the bar on the very far left. Can you read it from far away? That's the group of young people that weren't bullied at all. The group, the second from the left is the group that were bullied but reported no bias. And then the other bars are kids that reported bias-based bullying for race, religion, gender, because they are gay, lesbian, or someone thought they were, and disability. And I want you to watch the shape of this graph. This is for getting grades below C. And so you see a little bit of a disparity here in terms of low achievement. But when we move from academic achievement into some of the health behavior issues that we worry about for young people, you start to see a widening of this disparity. And in fact, maybe the kids that are bullied not due to bias don't look that different from the not. With 200,000 kids, everything's statistically significant. Whether it's meaningful is another discussion, right? But here you see that basically every one of the bias-motivated categories are substantially higher than the kids that aren't bullied or bullied, but they don't report a bias motivation for that. And if we start looking at missing school because you felt unsafe, being threatened with a weapon while at school, reporting depression, oops, and I went too fast. You see these big, and I think important, notable risk factors. And one of the things that's emerged in the last 10 years, I think, in the public health literature, it's fair to say, is that we really, before 10 years, we didn't have a good research literature to point to prejudice, stigma, discrimination, and trace its public health implications in the lives and well-being of people. And we're able to do that now. People in the health disparities field have begun to really think deeply about how do we measure. This is just discriminatory bullying, but there's a whole literature now on the ways that marginalization gets under our skin and affects our health and adjustment and well-being.